how often do I need to come, and what would that frequency look like? That's a question I get often, and I thought I might just take just a few seconds today, or a minute or two, just to kind of explain how we do things in our office and what determines that. And the first thing I would tell you is it's different for every one person, but our objective here at Desoto Upper Cervical is to get the atlas bone, which is the top cervical bone in our neck right here, right below the skull. We want to get that to become stable. So what we do when you come into the office, not only do we assess your films, but we also put you down and we have a system, what we call some pre-checks, and then we make the correction, and then we do some post-checks. And when we do those, at first they're kind of objective in the sense that you're going to be telling us and giving us feedback as to what your deficits are. We'll make the correction, and then we'll go back and we'll repeat those tests, showing both you and I that we've got a good correction, and those are now a negative in response to those tests. So once that happens, then we know that, okay, we've got a good correction, and now let's see how your body's going to react and perform with that. For some people, when we first start care, when you're more acute, that might mean that you might only hold your adjustment a day or two. We have a lot of things called muscle memory that might be pulling us back, how we sit in our office chair, how we drive our car, how we sleep at night, the type of stresses that we take on. Those are all applicable to this equation. But once it starts to hold, what's nice about care is once you start to hold, then we need to back off because your body's telling us it's becoming stable. So then the frequency of care becomes less and less. And that's different for every one person. If you've not had that experience when it comes to care, come talk to us here at Desoto Upper Cervical. We're at 662-393-4848.